Hey, how's it going? Welcome. For those of you who don't know, I'm an orthopedic surgeon. I work in Maryland and Washington, D.C. I do mostly hip and knee replacements. Hey, how's it going? If you have any questions, feel free to drop them in the chat. I'll go ahead and answer them. Where am I based? I'm based in Maryland and Washington, D.C. So I have an office in Germantown, Maryland, and then Washington, D.C. Is my second office, and then I have a surgery center in Maryland as well, and my main hospital is in Washington, D.C. I do have privileges at a lot of different facilities, and for those of you who don't know, I'm an orthopedic surgeon that's mostly muscles, bones, tendons. I do a lot of joint replacements, so a lot of same-day hip and knee replacements. I can do up to 6 or 8 surgeries in a day. And most of my patients are walking, getting up right away, and going home the same day. Hey, what's up? You're in you're in Maryland. That's awesome. In Nigeria. Welcome to the live stream. Thanks for joining. It's a long way from Nigeria. But that's what I do. I correct knock-knee deformities. I correct hip and knee deformities, and so I help people walk again. That's my main surgery I do is hip and knee replacement. Thank you for all the likes, double taps, appreciate it. I'm trying this new vertical live stream thing, but we'll see how it works out. You had your knee replaced in 2016 and you can hardly bend your left leg. Very sorry to hear that. Sounds like you developed something called arthrofibrosis. What that is where you develop a lot of scar tissue in your knee after the operation. That can be very problematic. Really, the only way to fix that is if you develop arthrofibrosis is to go in there and cut out all of the scar tissue and put in new replacements. You can afford to come over. Well, if you go to my profile, it's matthewharbmd.com/links. You can schedule a telehealth visit. So that's how I see people. I have a lot of people who travel to me for surgery. That's how I see them. Is it Korean? Sorry, I don't read Korean. If bones produce white blood cells, do teeth make blood? No. So you need the bone marrow to make the blood cells, and those are in your flat bones. So the most common one that bone marrow is in is actually your pelvis bone. So if we ever do a bone marrow biopsy or bone marrow transplant, and that's where we're doing it. I'm in undergrad. I want to go into orthopedics. Best thing you could do, try and get research. The more research you have, the better it is for your application. Where am I from? I was born in New Jersey, but I grew up in Louisiana, so I spent most of my life in Louisiana, and that's where I say I'm from. Also in Maryland. Looks like we're getting a lot of Maryland doctors in here. You're seeing an orthopedic in Townsend. I'm in, my main office is Germantown, Maryland, and so I do telehealth visits as well. I have a lot of people who see me from different parts of the U.S., from overseas, and who come to see me via virtual visits. And then if we do schedule surgery, they just fly in the day of surgery. You love my videos. Thank you so much. I very much appreciate it. Hey, Daniel, what's up? Hey, Breeson, what's up? Yeah, I can say your name, no problem. How long before your body starts eating the energy? Well, calories, you have to absorb them, and your body has something called glycogen stores. So usually what you use first is the readily available glucose, and then you start to eat into what's called your glycogen stores. So it takes a while to build that up. Love your videos. Thank you, I appreciate it. Try to do some educational, fun videos. What kind of surgeon? I'm an orthopedic surgeon. Can IMGs do orthopedics in US or Canada? Yes, but you need to do a special type of thing where you may need more years. Thoughts on hyaluronic acid for osteoarthritis? Yes, it's a good option. You can do Flexa, Synvisc. There's a lot of different ones. All the gels tend to work similar. How do you reach out in private? If you go to my profile, you can go to matthewharbmd.com/links. I have a Discord channel too. You can join my Discord channel. I respond to messages in there. I have people post x-rays in there sometimes. Or people do post x-rays, and I can help lead you in the right direction. Is chondromalacia common after failed surgery? Chondromalacia is softening of the cartilage. It happens. It can be a risk for if you've had surgery. Do you have an answer for this? Going for a patient, I have sharp pain in my chest, right and left side. It's hard to say. It depends what your demographics are. You know, people who have chest pain, we sometimes call it costochondritis, and we sometimes treat that with steroids. How painful is a toe amputation? Depends. If I've treated diabetics before where you had to take off the big toe, and because they were diabetic, they had peripheral neuropathy, so they didn't feel anything. Most of the time you're asleep and we numb up the area too, but obviously no amputation is ever comfortable. Knee pain after trochleoplasty, does it get better? Trochleoplasty is kind of like a preservation procedure. It doesn't always work, so if it doesn't work, then you may need some other procedure. Is the surgery expensive? Usually, so in the United States we have insurance, and that's what covers people's surgeries here. I had bursitis in my upper leg, and my rheumatoid doctor gave me a cortisone shot, but it didn't work. Sorry to hear that. If it goes down the back of your leg, it may be from your lower back or lumbar spine. Does a herniated disc heal? Thank you for all the double taps, likes. Very much appreciate the support for the channel. Herniated disc can stabilize. It doesn't always mean it's going to 100% get better, but it can stabilize over time. If it gets really bad or it's really pushing on the nerve, then we'll take it out. How many cases of neurofibromatosis have you worked with? That's more of a neurologist / general surgery type procedure. Orthopedic doctors don't treat that condition that much, but it's very painful. There's not really a cure. How expensive is surgery? It depends. As far as what the hospitals get, usually hospitals get $60,000 to $80,000 for a procedure. Out-of-pocket costs can be around $25,000, $30,000 depending on if you're paying out of pocket. But most people in the U.S. have cash. The problem is there's a huge cost to the implants. Some of these implants we use for different procedures can be upward as $10,000, $20,000 just for the implant cost. So it just depends what type of procedure you're doing and how complex it is. How can people get addicted to painkillers? If you use them short-term after surgery, it's very uncommon. Obviously, if you have a long-term pain condition and you're going to be on them more than 3 months, that's when you tend to worry that there's going to be a risk of some type of addiction. I have a hip labrum tear, and is surgery and recovery extensive? Yeah, it usually is, depending on how they do it. If they repair the labrum or if they go in and just shave it down, there's a different recovery time period. But, if it doesn't get better with any types of treatments, then that's a good option. Can ultrasound help with peroneal tendonitis? There are different therapies. There's one called EPAT therapy, which is a directed ultrasound therapy, and that can help with tendonitis. It is an option if nothing else is helping. Question, I had an OCD in the ankle, and a surgeon removed the broken fragment and then drilled holes. 4 years ago, still in pain. You probably developed some arthritis. It may be helpful to get a new x-ray and see what's going on there. You could even get an MRI to see how it's looking. What's the youngest hip replacement I've done? I've replaced a hip on an 18-year-old. Obviously, there's many reasons that we replace hips. Sometimes if the hip is just completely shot, we'll do it. If you have dysplasia, which means the hip never formed right. If you have a septic hip, which means you developed an infection in your hip, those would all be reasons. What is an orthopedic surgeon? So orthopedic surgeons, also we sometimes call them bone surgeons, but basically I fix bones that aren't right. So I do a lot of hip and knee replacements. Thoughts on TKA for younger patient? Yeah, I think it could be a good operation. especially if you have what's called post-traumatic arthritis. Like I've seen people who had a knee dislocation playing soccer, very young. They had a knee reconstruction, ligament reconstruction. Thank you for all the likes. Very much appreciate the support for the stream. Had a knee dislocation very young, and following that, they developed arthritis. And after the arthritis, they needed a replacement down the line because their knee was still unstable. So in the right situation, a lot of the times post-traumatic arthritis would be a common reason for doing a knee replacement in a young patient. 8 months post-op. From what? A hip or a knee? What should I do? My knee is purple? Hard to say. I would probably see a doctor. Knees are not supposed to be purple. Has anyone broken a bone from, I don't know what that is. Sorry to hear your knee's purple. I hope, I would definitely see your primary care practitioner. Do bone stimulators work? Yes. So if the bone's not healing, then that's when we use the bone stimulator. It helps to release calcium from the bone and can actually improve the healing process. To sit on, of course. Why do we have glutes to sit on? Do you need a replacement? I don't get the question. Some people need replacements, some people don't. If you have really bad arthritis and you have pain every day, that's a good reason to need a replacement. Thank you for all the double taps likes. Do you know anything? Let's see. No, unfortunately, Chester, I'm not. Yes, I'm in Maryland. A lot of people do telehealth. My main office in Maryland is in Germantown. How to go to the ER. Oh, how to get external rotation back after a subscap repair. You got to keep working on it. They do make some things called dynasplints, which allow you to which can kind of force external rotation. I would say most of your motion is within 4 months after the operation, but you can get improvement even up to a year. Do I do free surgery for people in need? I appreciate the question, but it's a loaded question because these implants that we do cost a lot of money. And, if the hospital said you could do free surgery, then I would do it. But, the hospital makes the rules. We don't make the rules. 8 weeks post-op total knee replacement. Having stabbing pain below my scar. Very sorry to hear that. There's different massage techniques. By 8 weeks, your incision should be healed, so you should be able to use some different scar creams, vitamin E ointment, Mederma cream, biocorneum, silicone gel. Those are all good things to help kind of massage it in. And that soft tissue should recover. I would say you'll see improvements after a knee replacement, even up to a year after the operation. What did you have for dinner? I had some tacos. How do you feel about combined ALIF and PLIF? Depends on the symptoms. In some people, it's indicated. The Shriners is a children's orthopedic hospital. I need a hip replacement. I live alone, single. How long will I need people to help me at home? Usually, depending on your age and if you're strong, only about 2 days or so. What are some bad injuries from sports you've heard of? You can get anything. You can break a bone, you can tear a rotator cuff muscle, ACL injury, MCL injury. Hey, what's up from Canada? Welcome to the stream. Thank you for all the support. Thank you for the likes. Very much appreciate it. Do you repair a shattered calcaneus? I have in the past. Currently, I'm doing mostly hip and knee replacements. I have a foot and ankle surgeon who's a partner who I usually send all my foot and ankle stuff over to. Treatment for moderate left hip space narrowing and osteophytes. Moderate, it depends. It depends how painful it is. If nothing's really helping, you could try a hip injection. I do diagnostic hip injections under ultrasound. A lot of people get better from those. If you don't get better from that and you just have continued pain every day, then I would probably look at doing doing a replacement. Was your Discord hacked? I have no idea. Let me look. I'll log into it and see. Action is needed. Let me see. No, my Discord doesn't look hacked. Nope, I'm on my Discord now. It doesn't look hacked, so that's good. Smith and Nephew, hey, what's up? I use a lot of Zimmer, Stryker. You got multiple messages from me? What? I don't send any messages really on... Smith and Nephew Sports, that's good. Did I dress up for Halloween? Yes. I think there's some pictures probably on my Instagram. I think you could see my tagged pictures on my Instagram. You could see what I was for Halloween. Oh, thank you. You let me operate on... Well, you haven't even met me yet. Hey, what's up? I do virtual visits, and so makes it easy for people who are traveling or out of town. Nail patella syndrome. So it just depends what the issue is. If you're having knee pain, yes. If you don't have a kneecap, then you could get a replacement. But it depends. If you have arthritis, depends. Those rare syndromes like nail patella syndrome and other ones, it just depends what the manifestations of those syndromes are. If you have arthritis, then the treatment would be a replacement. Do I do hip replacements? Yes, I mostly do hip and knee replacements. What degree do I have? I have a biology degree. You can go into medicine with anything. You can go in medicine with an English degree. A lot of people do biochemistry, biology. Yes. Am I using any products from Arthrex? I like their tightrope for their ankle. For ankle fractures, I'll use yeah, it's Bama week. Go Tigers. We'll see. Should be a good game. I'll be watching it with some buddies. Currently biochem, that's a good option to get into med school. But you can really, they like non-traditional people too. Oh man. What college did I attend? I went to LSU. Let's see. Did you get orthopedic experience as a third-year medical student? Yes. So really, third and fourth year, you can do rotations, which give you some experience, which is good. Thank you for the follows. Thank you for the double taps, likes. Appreciate all the subscriptions. Something in the back of my ankle near back of your knee would be your ACL. Could be a Baker's cyst back there. It's very common. Thank you. I appreciate it. What causes hip labrum tear? To not take. Well, if you have arthritis in the hip or you have what's called hypermobility syndrome, then a lot of the times the surgeries will fail. And if they fail, or then the next treatment would be a hip replacement. Hi, doctor. Are you originally from Lebanon? No, I was born in the United States. I have hypermobility Ehlers-Danlos syndrome. I had a bilateral total hip replacement. What are the chances of dislocation? I'll say that your chances of dislocation are higher than someone without hypermobility. Could be anywhere between 1 to 3% dislocation risk. I went to LSU. I have a blue dog, an LSU blue dog. I probably need to put it in the back. I had it in the back before. Or something LSU. Treatment for bone spurs in the neck. Well, if you have a pinched nerve from those bone spurs, you could do a couple things. You could do physical therapy, anti-inflammatories. Stronger anti-inflammatories would be steroids. Sometimes we do injections, and then decompression or fusion would be next. Thank you for all the double taps, likes. Very much appreciate it. Yeah, at some point I'll probably figure out the moderation thing. I didn't think you could spam the chat, but... Any advice for chronic hip bursitis? I would probably do an injection. If it's not getting better, then you could find out why. Is it from your back? Is it from your hip? And good luck with that. How long out of surgery to get a Hagelin's deformity removed? So usually for that, they'll take off your Achilles tendon and then reattach it. And so usually you have to wait for that to heal, which is at least 3 months. What hospitals? So Capital Orthopedic Surgery Center and Sibley Hospitals are my main 2 places I operate at. Knee arthrofibrosis surgery, injections type. It depends if it's after a replacement or not. If you developed arthrofibrosis after a replacement, then you probably need a revision surgery. 8 months after total knee, you still have pain. Very sorry to hear that. I would work up infection, instability, or loosening. Those are the most common problems. I'm at HSS. That's excellent. Congratulations. Do I scope at all? Yes, I will do scopes. You have good hair. Thank you. No, just hanging out. Brand new in the chat. We're talking about whatever you want. Arthrofibrosis, not after total knee replacement. You could get what's called a lysis of adhesions, where we go in there and we basically just clean up everything. This weekend I'm going to watch the LSU-Alabama game, so that should be enjoyable. Med school horror stories. Yeah, there was some crazy stuff in med school. There were a lot of people who actually got kicked out of my medical school. You would think when you make it that far, you know, you make it through college and you make it through into medical school, which is very competitive. But there was there were a group of people who actually cheated during anatomy lab, and 3 people got kicked out of med school. There was actually a lot of drama. Now that I'm thinking back, I have some crazy stories from med school. What kind of doctor are you? I'm an orthopedic surgeon. I had a bunion surgery, both feet. Soccer hurts. It can take up to a year to sometimes heal from these surgeries. Thank you, I appreciate it. No, I appreciate all the support for the channel. I mean, you guys have really been doing a great job. Appreciate all the double taps, likes, any comments you leave on videos. All that helps to support the channel. Just on here, answer to some questions. For those of you who don't know, I do a lot of hip and knee replacements, a lot of same-day joint replacements. How long should you have pain after hip replacement? After you had a fall? Depends if you broke anything with the fall. If you broke something with the fall, then it may take 2-3 months, but most of the time it gets better. If you develop bursitis, which is pain on the side of the hip after the fall, sometimes you'll need an injection for that. Bilateral knee replacement, August last year, still in a lot of pain. Did you have both at the same time? I tend to try to advocate against people having them both at the same time. So I usually will do one, let you heal up from it, and then do it again on the other side 3 months later. Knee occasionally locking after ACL surgery. You may want to get that checked, see if there's a meniscal injury. Thank you for all the likes and support for the channel. I had a revision on my knee, and the kneecap area is so very sensitive. Any hopes? There are desensitization procedures. You can go for what's called geniculate blocks. The pain surgeons will usually do that. Yes, have you ever broken a bone? Yes. Not that many though. I fell out of a tree house when I was very young and broke one of my fingers. Do I do orthopedic trauma? I do take trauma call. It is at a level 2 center, so it's nothing too crazy, but I do have experience fixing traumatic injuries. But you know, I don't really like being on call. You know, I like my day-to-day operations, see my patients, do my operations, and so I don't take a lot of call anymore. Please answer. It's really you guys are crazy. Chat's crazy over here. Well, how long to fully heal from both hips being replaced? Usually by 3 months, you're about 80% recovered. It can take up to a full year to really get back to sports and stuff like that. I don't put any restrictions on my patients after surgery. I do what's called a minimally invasive surgery, so it's about a 10 centimeter incision over the front of the hip. It usually works pretty well. How long after tibia hardware is removed can I get an MRI? Usually right away. Hip popping, hip dysplasia. Yeah, hip dysplasia is a common reason for needing early hip replacement. I do telemedicine visits. I have a Discord channel as well. If you go up into the links profile, you can see my Discord. I do have, let's see, So my Discord is up right now. So like if anyone wants to throw any x-rays in my Discord, let me see. Let me make sure there's nothing on this. So if you want to throw any x-rays, I do have my Discord up. You can post any x-rays or any questions in the Discord channel too. I will answer those. It's MatthewHarbMD.com/links to get to all those. Synthes, Zimmer, or Stryker. I use everything. So trauma, I use Synthes. Revision, knees right now, I use Stryker. I use a lot of Zimmer, hips and knees. Revision hips, I use DJO. So I use a lot of different stuff. Smith and Nephew every now and then. Someone will request what's called an oxynium knee. I may use that, but Zimmer has a titanium knee. I had double hip replacement 8 months ago. It was the best thing I ever done. That's excellent. I'm glad you're doing well. That's really the goal. It's a quality of life procedure. Do you recommend collagen supplements for knee pain due to running? I started taking Neo-Collagen, had good success. Turmeric is really very good. Anything like this. Let's see. I made this one, joint support. Anything with turmeric. Let's see if we can put up, yeah. Anything with turmeric on it. You probably can't see that, but it's like 800 milligrams a day. You can get them anywhere. You can get them on Amazon. You can get them on CVS. And so anything like that can be helpful for joint inflammation. Turmeric is amazing. I take it every day. My website is harbnutrition.com, where I put something together that has turmeric and hyaluronic and some glucosamine and chondroitin, which is helpful for joints. But really, ultimately it's ruling out any type of injury or any type of organic cause of pain, and then, trying to get that to heal. And then if that doesn't work, then looking for surgical options. We're not going to get into politics on here. Politics is a no-no. But I do have my Discord channel up if anyone wants to join. You can post the x-rays and things like that, talk about different conditions. I do answer the questions on there. What helps bones heal? Vitamin D, calcium does. Thank you for all the double taps, likes. Very much appreciate the support. After running a long time marathon, my knee hurts. Make sure you train for it. If running hurts, then just minimize the amount you're running. But it depends how bad it is. How often you're running marathons, how much you're training. Running a marathon is not a natural thing by any means. Harbnutrition.com. That's the website if you're looking for turmeric. What orthopedic surgeries do you do? I do a lot of hip and knee replacements. Yeah, I mean, these chats get a little crazy, so I'm just really on here to try to help, answer some questions. Politics, religion, I try to stay away from. How to slap, what sneakers do you recommend for broken heel? Hoka's really good. I like Asics, but Hoka's great. They have a very supportive sole. They've been doing really well. I don't think I've made any moderators yet. I'll probably have to make some. Where am I from? I grew up in Louisiana. Incoming med student, any advice? Find out what specialty you want to do, and once you've picked what specialty you want to do, then you go and try to, if it's a very competitive specialty, try to get research for it. If it's not that competitive, then you probably just don't have to get that much research. But research will make you more competitive. Welcome to the live stream. If you're just joining in, I do a lot of hip and knee replacements. I'm in Maryland, Washington, D.C. Thank you for all the likes, support. Can I get mod? Maybe one day. Work hard, and maybe one day you can be a moderator. Can I run again if I have a knee replaced? I do replace people's knees, and they do go back to running. It depends, if you were a runner before, if you have good muscle tone, it usually takes kind of 9 months to a year to get back to running though after knee replacement. Do you use TXA in my cases? Yes. For those of you who don't know, TXA is a great medication. It prevents bleeding. I do a lot of outpatient surgery, so my patients go home the same day. I haven't had to transfuse anyone in the last 5 years after an operation. So what made you want to be a doctor? Well, at first I really wanted to be an engineer, but I had terrible engineering mentors. The engineering prep program I was in, the guy actually got fired. And from there I was like, well, what else can I do? I was good at math and science, so I went that route. And orthopedic surgery is basically like engineering. It's just the human body. You're reconstructing joints. You're getting people to walk again. You're allowing them to be functional and moving. So it's great. I love it. So, I like fixing people. I love operating. What's your favorite drink that's not water? I shouldn't say that one. Favorite drink that's not water? Something with caffeine. You work a lot. And if you work a lot, you need caffeine. So you got to get it in your body somehow. The problem is all these drinks now, they have so much freaking caffeine in them that we're probably as a society kind of all overdosing on caffeine. Did you do a surgery sub-I before residency? Yes, I did. Thank you for all the double taps likes. Thank you for the support. Engineering usually has nice handwriting. Yeah, my handwriting used to be nice. I think when I started medical school, my handwriting was very nice, and then it just went downhill from there. The back of my knee hurts bad. Probably a Baker cyst. That's the most common thing. Could be meniscal tear. Anthony's writing letters of recommendation now. Torn meniscus, any suggestions? Usually physical therapy, anti-inflammatories. Some people who don't want to take medications are trying turmeric. Here's a good turmeric on harbnutrition.com. It's 800 milligrams turmeric twice a day. That can sometimes help. Physical therapy, injections sometimes help. There's gel injections, there's PRP injections, there's cortisone injections. PRP is what's called platelet-rich plasma. It's something we're doing more of. The literature is a little mixed, but basically we draw your platelets and we spin them down. And then after we spin them down, we get the platelets in high concentration with growth factors, and then we inject them into the joint, knee, tendon, and that can sometimes help minimize inflammation and get some healing to be done. Slight hip separation, is surgery required? It depends what you mean by hip separation. If you have hip instability, like hypermobility, then usually a surgery is required. But if it's just like a labrum issue, then you can sometimes get that to heal without it. How to prepare for gallbladder removal? That's a great question. I know you don't eat before surgery, but I don't take out gallbladders. I fix bones. What's your BMI limit for hip replacement? That's a great question. Our literature shows that at BMI 40, when you get above BMI 40, the risk for infection goes up, but there's kind of relative cutoffs. Will I operate on people higher than BMI 40? Yes. Like if you come in at BMI 50 and you show some great progress to get down to BMI 45, then, that's good motivation, and I think you'll continue to do it after, so I'll probably operate on you. Ozempic has been a great medication. These GLP-1 medications have been great for people who lose weight to get less pressure off their joints, and that can be really good. Options for 25-year-old with post-traumatic arthritis. If you have post-traumatic arthritis, we're usually fixing the joint. I have this little YouTube light. I don't know if I should turn it on or not. I have a lot of lights on right now. Thank you for all the double taps, likes, subscribes. Very much appreciate the support for the channel. The vertical is supposed to show in the feed now, so hopefully this works. Spinal fusion, last resort option. Let's see. I do have a Discord channel up. The Discord, anyone can join that. What would you prescribe if a person cannot take Ozempic because they have thyroid cancer in the family? I would check with your primary care. There's different types of GLP-1 medications, so I don't know this. I don't prescribe it. I usually send you to your primary care to get it prescribed. Scoliosis revision, that's going to be painful. That's a big operation. I would try to avoid it if possible. How do you ensure a new joint won't cause a leg-length discrepancy? Well, 20% of people have a leg-length discrepancy to begin with. Many people who develop arthritis, like hip arthritis, who need a joint replacement, their joint actually gets a little bit shorter. And so the first goal of a replacement is stability. And so sometimes that may change the leg to even it out. I use x-ray during my surgery to try and make the legs perfectly even. Sometimes if the legs are brought to even and you were very short before, you may feel longer, but that tends to go away after a year. I do sometimes send patients to chiropractors if they have relief in the back. The biggest thing I'd recommend is just don't manipulate the neck if you like it. Chronic regional pain syndrome, you can sometimes freeze or burn the nerves. Hypermobility, all life, yeah, I would see orthopedic. So you may have EDS, which is called Ehlers-Danlos syndrome. It's basically all your joints just slide everywhere, all over the place. It's one of the most painful conditions. Can you correct a bunion without surgery? Usually not. None of these braces are going to work for the bunion. And Jamal asks in the Discord channel, is meloxicam a good anti-inflammatory? Yeah. Yes, meloxicam is good. I usually prescribe meloxicam or Celebrex. Chiropractor here, 20 years. I've done a couple 100,000 neck adjustments without compromise. That's great. You know, the thing is, you've been in practice 20 years. The problem that really exists is there's a lot of young people on social media who see all these cracks and pops and Y-straps, and I've seen the problem is you guys don't see the aftermath of vertebral artery dissection, and they are becoming much more prominent now with neck manipulation. So if you've been in practice for 20 years doing neck manipulations, you probably know how to do it safe. But I would say not everyone knows how to do that, and the Y-strap's a terrible invention. And I've seen 20-year-olds, 23, 25-year-olds come in completely paralyzed from neck manipulations. And it just takes one, right? It just takes one of those to be able to say, look, you know, it's helpful maybe for some people, but the risk just isn't worth the reward. So my recommendation is avoid neck manipulations. You earn that YouTube light with your fantastic content. Let it shine. Let me see. I think I have to plug it in or something. Yeah, it probably needs a cord. All right, let me see. I don't even know if I've ever plugged this thing in, so I don't even know if it turns on. Let me see. Maybe hopefully the cord reaches. I don't even know. Yes, if you do have inflammation, turmeric can be a great supplement. I do have some on a combination turmeric glucosamine chondroitin on harbnutrition.com. All right, let's see if this thing lights up. Doesn't look. Oh, there we go. Look, we got a little light. Oh, it doesn't reach. I don't think it reaches. Give me 1 second. I'll try one more time. Yeah, I don't think it's gonna reach. I gotta adjust my shelving, I think. Okay, that's not gonna work. All right, well, we'll do the light later. We need to adjust the setup. I need more stuff. All right. Had both knees replaced. Surgeon made my legs straight, and now I hate them. What? It must not have been that long. I need to get some models too, so we can talk about like some different anatomy for some of these conditions. What's a great gift for my orthopedic? Alcohol is always good. Or something funny. I have this one lady, I replaced her knee. She always brings me in, she's Hawaiian, and she always brings in these Hawaiian snacks. They're so good. But I've gotten people have brought me coffee, people have brought me alcohol. I have a guy who loves to barbecue. He brings me a rub every now and then. It's fun, it's enjoyable. I had someone bring me a bunch of papayas one time. What else? I've got a lot of gifts. Someone sent me this gift box with fruit in it, like the specialized gold wrapped pear. Very odd, but it was good. Great pear. Alcohol is always a good gift. You have friends, you entertain. Treatment for edema of the foot. If it's on both legs, I would check your heart and liver and kidneys. I just found out I need a double hip replacement. Is it a hard recovery? Depends. I would go with direct anterior approach. I do telemedicine visits. I do virtual visits. You can always, at MatthewHarbMD.com/links up in my bio. I do virtual visits, but I do direct anterior hip replacements. That's the quickest recovery. I do a lot of same-day operations. Patients are up and walking within 30 minutes to an hour after their operation. Would you consider yourself an ortho bro? I don't know. Yeah. Orthopedics is for everyone. Yes, the number of females in orthopedics is less. We need to get more orthopedics. Let's see what let's see. Jamal says, do you think the extra pain isn't from it then? Probably from the meniscal tear. So I do have a Discord channel. I have the Discord up. You can ask questions in there. You can post x-rays. I can talk about anything you put in there. Hip replacement's a pretty quick recovery. Out of all the joints, that's the best operation in the last 100 years. So hip replacement's an excellent operation. Please talk about knee pain on the outside. Woman, PT, says there's nothing wrong. Outside of the knee, it's usually the iliotibial band, so it could be IT band syndrome, it could be an LCL sprain, it could be meniscus. If nothing gets better, you may want to get an MRI. Sing happy birthday. Oh, sorry. Could probably get someone else to do it for you, but I'm a surgeon, not a vocalist. What's the toughest surgery you had to do? Probably multi-trauma. I had a guy in New York. I was in New York for 5 years. I had a guy in New York. He got thrown off a building. Got robbed, and then they threw him off the building. He fell about, it was like 5.5, 6 stories. Broke everything. And he was a young guy. He was like in his 20s. He had 2 surgeries that we did on him. Both operations were 16 hours, and they were basically one day after the other. That was a crazy one. I had another guy fall off a building, broke both the wrists, and had like gravel in both the wrists. That one took a while. That one started at 2 in the morning. What's your Discord channel name? It's Healthcare Hub. If you go to MatthewHarbMD.com/links, you can join it. Can I put something in? See what I can do. Creator tools. Start a poll. I guess I can start a poll. That's it. Have you had surgery? Ask your community. Surgery. Oh gosh. Let me try this. Yes, you are. All right, there we go. Surgery. Yes or no? Let's see how that works. Have you had surgery before? Hammer toe, how long before I can walk on it? Depends when it heals. If they put a pin in, a lot of the times they put a pin in, but you want the bone to heal. It's usually 8 to 12 weeks for it to heal, but you can usually start walking on it a little sooner. Where did you work in New York? I was at SUNY Downstate in New York for 5 years. Seeing a hip surgeon tomorrow, possible hip impingement. If you have hip impingement, it may be a scope procedure, and if it's a labrum tear. If it's arthritis, that may be a replacement. So it just depends how bad the impingement is. If it's a very bad impingement, replacement. I'm located in Maryland. I do telehealth visits. If you click on my link in my bio, MatthewHarbMD.com/links, or you can just search me on Google, Matthew Harb. You can find all my links, my profile. You can set up a tele visit as well. Trigger finger after carpal tunnel surgery. I would do an injection for it. Can I have a shout out? Titan, happy birthday, buddy. I wish you many years of birthdays and happiness. Do more votes. 17, let's see. How do you fix a broken bone? Oh, wow. 76% of people in here have had surgery? What? That's crazy. Okay. That's a lot. How do I get rid of this thing? Okay. Do I do appendix surgeries? No, I'd mostly do bone surgeries. 57-year-old male, success rate of a hip fusion takedown. It's a very high complication rate. 20%, 25% complication rate with hip fusion takedown. Some people will do it. Okay, in the Discord chat, Jay Greer asks, 2.5 months after total knee replacement, difficulty sleeping, uncomfortable. Any tips? I usually prescribe my patients Benadryl 25 to 50 milligrams. If that doesn't work, I will send over muscle relaxers or sometimes Ambien. Thank you for all the double taps, likes, shares. Appreciate it. How do you fix bones? You fix bones with metal. Surgery, 22 votes. 77% said yes. Benadryl 25 milligrams to 50 milligrams. It's the same as like Equate sleep aids. It's like the Unisom stuff. All the stuff has very similar. That's what I usually prescribe for my post-surgical patients who can't sleep. Opinions on manipulations under anesthesia, they're usually done 3 to 4 weeks after the, within 3 to 4 months of the operation to try to get full motion back. How successful is hip labrum surgery? It depends. It's a preservation procedure. You're trying to prevent it from getting worse and developing arthritis. And so it can be very successful. What if someone has a coma and cancer? What would you do? I would probably let them be. Does hip replacement ever heal? Yes. I do what's called direct anterior hip replacement from the front, and that usually works pretty well. My hip has popped out since a car accident at 12. Very sorry to hear that. Probably a joint and muscle issue. I had a total knee replacement in October 10th, doing well. How soon do you wait to replace the other knee? At the earliest, I will do 4 weeks apart, but if people really want to recover, I would do 3 months in between replacements. If a patient had a total hip replacement at 45, when can they expect a revision? I would say you maybe won't even need a revision. The data we have right now is that 65% of hips are still intact after 30 years, so you know, there's a good chance, more than 50% chance that it lasts more than 30 years. Knock knees need a replacement due to damage. Can they straighten the leg? Yes. Depends on the degree, but angulations, even up to 25, 30 degrees, you can correct with a knee replacement. Yeah, we can fix any bone. Mako, robotics. Aseptic loosening on a total hip replacement. Historically, things used to wear out. I use Zimmer right now. I can't fix a broken heart. Only time will do that, and maybe some workouts. When I stand, my knee goes inward and it's painful. Any advice? I'd probably get an x-ray, see what it looks like. Thank you for all the double taps, likes, support. Appreciate the support for the stream. Why not Mako? Well, because for Mako, you have to put extra pins in the bone. Nothing shows better results yet. So clinically, there aren't better results, and it takes more time, and it's very expensive. Oh, let me grab a cough drop real quick. All right, we'll answer a few more questions here. Let's see what we got. Just got a cortisone shot for plantar fasciitis. Ouch. Yeah, that's a really uncomfortable shot. Probably one of the more uncomfortable shots. What is blunting of the labrum? It just means it doesn't look like it normally should, so there's probably some slight tearing there. I mostly do hip and knee replacements, so I do a lot of minimally invasive hip and knee replacements. I have a great website. I have what's called a joint replacement booklet. That's online on my website, MatthewHarbMD.com. Very good information there. What can inner knee pain be from? It can be from arthritis. It can be from a meniscal tear. Who's this? Dean Harb? Certified PA. Hire me. I close fast. It looks amazing. All right. Hey, Dean, send me a email. I'm looking for a PA. So I do a lot of outpatient surgeries, a lot of hip and knee replacements. 5 weeks post-op TFCC repair. Hopefully you're doing well. Ligaments always take longer to, what's your favorite food and snack? Snack, probably a protein bar. Favorite food, sushi. Definitely sushi. Sushi's probably both. I do mostly hip and knee replacements. I've done spinal surgeries in the past, but not right now. Why'd you choose to be an ortho bro over any other specialty? I like fixing things, and so I never wanted to treat chronic disease. I wanted to do an operation, get people better, get people walking again. And so orthopedics is great for that. Turmeric's a great supplement. This is on my website, harbnutrition.com. It's called Joint Support. It has turmeric, it has glucosamine, it has chondroitin. It's basically a good combination for joint support, providing some nutrition, some supplementation there. Where am I located? I'm located in Washington, D.C. and Maryland. I also do televisits, so I have a lot of people who travel for surgery out of state, and you can do a virtual visit. So we can you can send me your x-rays via email, or you can, if you have x-rays, you can put them in the Discord channel too. So I have the Discord up, looks like someone put in an x-ray in the Discord. Let's see. Okay. Had a fall this summer, and the ortho surgeon is my new best friend. Okay. Can you guys tell what's going on? Sorry, my computer's dirty. I should probably clean that up. All right, this was posted in the Discord. What is it? What's going on? Any guesses? Diagnosis? Anyone want to say? I need something cleaner, like an iPad. Yeah, the knee's not in the right spot, so that thing's out of place. I thought I had a thing to wipe it down with. Maybe I don't. That thing's out of place. The problem is, you're gonna have to you can lose your leg with a knee dislocation like that, so that's really bad. What's the treatment for fractures of the, no, so the knee is dislocated. So here, I'll put the x-ray up one more time. Yeah, the knee is gone. Like, it's supposed to be here, it's here, not where it's supposed to be. It was me in surgery recovering now. Wish you a speedy recovery. Hopefully your leg is okay. These type of injuries really lead to arthritis. I've seen people with knee dislocations lose their legs, so hopefully there wasn't a vascular injury. What are your thoughts on spinal cord stimulators? It's usually like a last resort type thing. Hey, how's it going? What's up, Sheepo? Welcome to the channel. Anyone who wants to join the Discord, feel free. It's supposed to be the healthcare hub, basically, so people can throw questions in there. I do have a couple other doctors on there. There's a pain doctor, a spine doctor. 12 weeks after total knee replacement, still feels like glass behind the kneecap. It usually gets better with time. What's chondromalacia? It's softening of the cartilage, usually behind the kneecap. Did I get a haircut? Yeah, actually I did. Thanks for noticing. It wasn't that long ago. Do I do any foot surgeries? I did in the past. Right now I have a foot and ankle partner, so I send a lot to him. Discord, please. Go to MatthewHarbMD.com/links. And you can get to my Discord. So if you go to my profile, you'll see at MatthewHarbMD.com/links. And then the website for the turmeric supplement, that's on HarbNutrition.com. But you can Google either one of those. MatthewHarbMD.com/links or HarbNutrition.com. What's the treatment for chondromalacia? Well, usually it's trying to protect the knee, a lot of physical therapy. Thank you for all the double taps. Likes, follows, very much appreciate it. My son's name is Matthew. Good name. Yeah, it is a good name. If anyone wants to post their x-rays in the Discord channel, I do have it up. I am looking at it. If you post an x-ray in there, we can always talk about it. I can talk about it live on the stream. Happy to do that. I was semi-pro. I had a talus OCD. Ortho did bone cement. Now I have chronic regional pain syndrome. Step 1, I want to play again. Chronic regional pain syndrome, I would say, so this was a question by Britt in the chat, in the Discord channel. I would say it may be helpful to try high dose, 500 milligrams twice a day, vitamin C treatment, or steroids, and if that didn't work, you could try ablation versus genicular blocks. Left Mo on the Discord channel says left hip focal cortical offset. Oh. Basically it says you may have a hip fracture. Get an MRI to confirm. MRI is better than CT scan to rule out a hip fracture, so. What's harder, a knee or hip replacement? They're about equal. It takes me about 45 minutes to an hour to do both. What did you score on the MCAT? I think I made like a 36 or 37 on the MCAT. Thank you for all the double taps, likes, support. Very much appreciate the support for the channel. Thoughts on multi-level fusion? Depends. If nothing's helping, then that's an option. I'll reply and say, should get an MRI. Should get an MRI to confirm. What about a hinge in the knee? Hinge is for very severe ligament instability. A hinge would be if none of your ligaments work and you have severe arthritis. I have severe pain behind my knee for the last 3 years after a fall. You probably have an injury and a Baker cyst there. Oh, X-ray result. If that was the issue with an X-ray, then I would get the MRI to rule it out, rule out a fracture. No meniscus left. Grade 4 cartilage loss, lateral side of the knee. Grade 1 to 2 on the medial. What's next? Probably a knee replacement, but 22 is young. I would try injections with cortisone, gel, PRP injections. What's a rotator cuff tear? So your deltoid muscle goes to here, rotator cuff is overhead. So if you tear your rotator cuff muscle, you have pain with overhead motion. And so a lot of times we can fix that with an injection. Oh man. Well, okay then. How long does a new hip replacement last? At 30 years, more than 65% are intact. Yeah, so all my links to my telemedicine visits are in my bio, MatthewHarbMD.com/links. Ever dealt with Ehlers-Danlos patients? Yes, I see them all the time. Yes, turmeric is a good anti-inflammatory. I have bilateral hip dislocations. What will happen? You could develop post-traumatic arthritis. When a knee is dislocated, how long does it take to recover? Could take a year. I recently broke my hand. Most of the time, if you just break a hand or finger, we can put you in a cast and you heal up just fine. Does nerve damage in the back repair itself? It can sometimes get better. How long should it take for a tibial plateau fracture with PCL avulsion to heal? Well, it depends if they're repairing your PCL or not. Hopefully you don't develop arthritis, but it could take 9 months to a year to get better. The fracture itself should heal by 3 months, but the question is, how long will the ligament take to heal, and will it heal? How old am I? I don't know. How old do you think I am? Do you do stomach surgery? Do you do stomach surgery when people pay you money? No, I do not do stomach surgery. I do a lot of hip and knee replacements. And people don't pay me money. Insurance companies pay me money most of the time. Ever deal with Marfan's patients? Yes, I have. If I do a hinge while walking them. Yeah, people can walk on hinges. Do I use on-cue pumps? Yes, I have in the past. I don't normally use it. I use what's called a single shot injection. How many steroid injections do you recommend getting in the knee within a year? I would say 3 to 4 would be max. All right, well, I appreciate all the questions. If I didn't get to them, you can always drop them in my Discord channel. I do read those. I'll do some more lives down the road. But appreciate all the support. Hope everyone has a great rest of their week. See you guys soon.